The striking and sobering fact is that many people over 60 are walking around with eGFR numbers in the 60 to 70 range without any symptoms whatsoever, not knowing that their kidneys are already working at reduced capacity and continuing the same daily kitchen habits that are slowly pushing that number lower year by year. If you are over 60 and you have not had your kidney function checked in the past year, that is something you should bring up with your doctor at your very next appointment. Let us now talk about what you can actually do, because this is not about fear, this is about empowerment. The kidneys have a remarkable ability to stabilize and, in some cases, partially recover their function when the damage-causing habits are removed. Research has shown that reducing sodium intake can lower blood pressure within just a few weeks, and sustained sodium reduction over months is associated with meaningfully slower decline in kidney function in older adults. So what does reducing sodium actually look like in a practical, everyday kitchen setting? It starts with awareness. Reading food labels and paying attention to the sodium content per serving of everything you buy is the single most powerful first step. A can of popular condensed soup can contain over 900 milligrams of sodium. A single serving of deli turkey can contain 400 to 500 milligrams. 2 slices of regular white bread can contain 300 milligrams. These numbers add up with terrifying speed across the course of a day. Cooking from scratch as much as possible gives you control over exactly how much sodium goes into your food. And here is something encouraging. Research on taste perception shows that when people gradually reduce their sodium intake over a period of 4 to 8 weeks, their taste buds actually adapt and recalibrate. Foods that initially taste bland start to taste satisfying and flavorful again. You begin to taste the natural flavors of vegetables, proteins, and grains that were previously masked by excessive salt. Many people who go through this process say that after a couple of months, heavily salted food actually starts to taste unpleasant to them. The adaptation is real and measurable. Your palate can change, and the transition is much easier than most people expect once they commit to it. Using herbs like rosemary, thyme, and oregano, or spices like garlic powder, smoked paprika, and cumin, or adding acidity through lemon juice or a splash of vinegar can make low-sodium cooking deeply flavorful and satisfying without ever reaching for that shaker. There is also the question of hydration, which is closely connected to kidney health and sodium management. Many older adults do not drink enough water throughout the day. This matters tremendously for the kidneys. When you are not drinking enough water, your urine becomes concentrated, which means the kidneys are filtering a higher concentration of waste products and minerals through less fluid, increasing the risk of kidney stone formation and slowing the removal of toxins. Adequate hydration helps dilute sodium in the bloodstream and makes it easier for the kidneys to excrete excess salt through urine. A useful and practical guideline is to pay attention to the color of your urine. Pale yellow means you are well hydrated. Dark yellow or amber means you need to drink more water. If you are over 60 and you find you rarely feel thirsty, that is actually a warning sign. The thirst mechanism becomes less sensitive with age, meaning you can be significantly dehydrated without feeling it. Making a conscious habit of drinking water at regular intervals throughout the day, regardless of thirst, is one of the best things you can do for your kidneys. Let us also address a few other kitchen habits that interact with sodium to harm kidney function in older adults, because the salt shaker is the biggest culprit, but it is not the only one. Excessive caffeine from coffee and certain teas can cause a transient increase in blood pressure and can mildly impair kidney blood flow when consumed in very large amounts, though moderate coffee consumption has actually been studied with mixed results and appears to be fine for most people in reasonable quantities. Alcohol, however, is a different story. Regular alcohol consumption dehydrates the body, raises blood pressure, and directly stresses the kidneys. For someone over 60 with any degree of kidney function decline, alcohol adds a significant load on organs that are already working below their peak capacity. Processed meats like bacon, sausage, ham, and deli meats deserve a specific mention because they combine two kidney-damaging factors simultaneously. They are extraordinarily high in sodium, and they are also high in phosphorus, which is another mineral the kidneys struggle to manage as their function declines. Excess phosphorus in the blood pulls calcium out of bones, weakens them over time, and can deposit in blood vessels and soft tissues, causing damage that extends far beyond the kidneys. This is why kidney specialists, when they give dietary guidance to patients with reduced kidney function, almost always emphasize reducing not just sodium, but also processed and cured meats. The kitchen habit of relying on these foods as quick and easy protein sources is one of the most common patterns doctors see in older patients who are experiencing accelerating kidney decline. Now, here is something hopeful and important that ties all of this together. A large-scale study published in a major medical journal followed thousands of adults over several decades and found that people who consistently followed a diet low in sodium and processed foods and rich in vegetables, whole grains, and lean proteins had a dramatically lower risk of developing chronic kidney disease as they aged, even when they already had some of the common risk factors like mild hypertension or borderline blood sugar levels. The lifestyle changes made a meaningful difference regardless of genetics, regardless of whether they started late in life, and regardless of whether kidney function had already begun to decline slightly. The kidneys respond to kindness. They respond to being given less to deal with. The body has a remarkable ability to stabilize and strengthen when the sources of daily damage are removed or reduced. One more thing that is worth understanding, especially for anyone over 60 who takes regular medications. Certain common over-the-counter medications, including non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, which are sold under names like Advil, Motrin, and Aleve, can significantly reduce blood flow to the kidneys and accelerate kidney damage when taken regularly. Many older adults reach for these medications frequently for joint pain, back pain, or headaches without realizing the cumulative toll they are taking on kidney function. This is especially dangerous when combined with a high sodium diet because both the medication and the sodium are stressing the kidneys simultaneously. If you regularly use over-the-counter pain relievers and you are over 60, this is absolutely a conversation you need to have with your doctor. There are safer alternatives for pain management that do not carry the same kidney risks, and your doctor can help you find an approach that works for your specific situation. Let us take a moment and think about the bigger picture here. We live in a food environment that is engineered to be high in sodium. The processed food industry adds salt not just for taste, but because it extends shelf life, enhances texture, and makes food more addictive. The average American is surrounded by high-sodium options at every turn, and for older adults who grew up in an era when canned and packaged foods were introduced as modern convenience, many of these products have been part of daily life for decades. Changing a deeply ingrained kitchen habit is not a small or easy thing. It requires awareness, intention, and gradual, consistent effort. But the stakes for someone over 60 are high enough that the effort is absolutely worth it. Your kidneys are not just quietly working in the background. They are holding the foundation of your entire health together. When kidney function drops significantly, it does not just affect how you feel day to day. It affects your heart, your bones, your blood pressure, your energy, your mental clarity, and your overall quality of life in ways that are hard to fully appreciate until you are in the middle of managing them. The good news is that you do not have to overhaul everything overnight. Small and consistent changes made over weeks and months can have a genuinely meaningful impact on kidney health, blood pressure, and overall well-being. Start by reading the sodium content on the foods you buy most often. Identify the 2 or 3 highest sodium items in your regular diet and find lower sodium alternatives or homemade versions. Cut back gradually on the salt you add during cooking. Drink more water consistently throughout the day. Talk to your doctor about getting your EGFR tested if you have not had it done recently. And if you are taking over-the-counter pain medications regularly, have that conversation too. These are not dramatic, life-altering changes. They are small, practical adjustments that compound over time into a very significant protective effect on your kidney health. Before we wrap up, there is one more thing worth mentioning, and that is awareness versus action. There is a huge gap between people who hear information like this and nod along, and people who actually use it to make a change in their kitchen tomorrow morning. The research is clear, the mechanism is understood, the practical steps are accessible. What bridges the gap between knowing and doing is usually the moment when something feels personal and real. So I want to ask you something, and I genuinely want to know your thoughts on this. Have you or someone you love been told that their kidneys are not functioning as well as they should? Have you noticed any of the symptoms we discussed? The swelling, the changes in urination, the blood pressure that is harder to manage? Or maybe you have been eating a high sodium diet your whole life, and this is the first time you are thinking seriously about what that might be doing to your kidneys over time. Leave a comment below and share your experience. Tell us what sodium habits you are working on changing, or ask a question about anything we covered today. Your comment might be exactly what someone else watching this video needs to hear to take their own first step. And if you found this information valuable, please share this video with someone you care about who is over 60, because this is the kind of information that genuinely can make a difference in someone's health and quality of life, and they deserve to know it. Your kidneys are working for you every minute of every day. It is time to start working for them. Most people over 60 have no idea that one of the most damaging things they do to their kidneys happens every single morning, right in their own kitchen, before they even sit down for breakfast. And the worst part is, it is not something unusual or extreme. It is something almost every American household does without a second thought. Doctors see the consequences of this habit in clinic visits every single week. But because it looks so normal on the surface, most patients never connect the dots until significant damage has already been done. By the time the symptoms show up, the kidneys may have already lost a large portion of their filtering ability, silently and without any pain. Today, we are going to talk about exactly what that habit is, why it is so dangerous specifically for people over 60, and what simple changes you can make starting right now to protect your kidney health before it is too late. Before we get into the heart of this discussion, here is something that might surprise you. The kidneys are two of the most underappreciated organs in the human body. Most people only think about their kidneys when something goes wrong. But here is the truth. Your kidneys are filtering your entire blood supply every single 30 to 40 minutes. They manage your blood pressure, regulate electrolytes, produce hormones that tell your bones to stay strong, and remove toxic waste from everything you eat and drink. And after the age of 60, kidney function naturally starts to decline by about 1% every single year. That means by the time someone reaches 70, they may already be working with kidneys that are 10% less efficient than they were a decade earlier. Now, add a damaging daily kitchen habit on top of that baseline decline, and you have a recipe for serious kidney trouble that can silently progress for years. So, what is this kitchen habit we are talking about? We will get there very shortly. But first, let us understand why the kidneys of someone over 60 are so much more vulnerable than those of a younger person. When you are young, your kidneys have a large reserve capacity. Even if you are a little hard on them, they can bounce back. They adapt, they compensate. But after 60, that reserve is shrinking year by year. The tiny filtering units inside the kidneys, called nephrons, are not replaceable. You are born with roughly 1 million of them in each kidney, and once they are damaged or lost, they are gone forever. The kidneys you have today are the kidneys you will have for the rest of your life, which is exactly why the habits you maintain in your 60s, 70s, and 80s matter enormously, far more than most people realize. Now let us talk about the kitchen. Let us talk about salt. Specifically, the habit of adding salt to food while cooking and then adding even more at the table. For most Americans, this is as automatic as breathing. The salt shaker is right there on the counter. You cook your vegetables and you sprinkle in salt. You scramble your eggs and you add salt. You boil your pasta water and in goes a generous handful of salt. You sit down to eat and you reach for that shaker again before you have even taken a single bite. This is the habit that is quietly devastating kidneys across America, and it is especially dangerous for anyone over 60. Here is what is happening inside your body when you are consuming too much sodium. Your kidneys have to work overtime to filter out the excess salt from your blood. Sodium pulls water into your bloodstream, which raises blood pressure. Elevated blood pressure, in turn, puts extreme mechanical stress on the tiny blood vessels inside the kidneys. Over time, this damages those nephrons we talked about, the ones that can never be replaced. High sodium intake also directly injures the kidneys through something called hyperfiltration, where the kidneys are forced to work so hard and fast that the very act of filtering causes physical wear and tear on the tissue. Researchers at major medical institutions have found that people who consistently consume high levels of sodium have a significantly faster rate of kidney function decline over time compared to those who keep their sodium low. For someone over 60 who is already experiencing natural age-related decline, this is not a minor issue. This is the difference between keeping healthy kidney function well into their 80s versus facing kidney disease by their early 70s. And here is the part that makes this even more alarming. The American diet is not just high in sodium from the salt shaker. Research from the Centers for Disease Control and Prevention has shown that the average American adult consumes well over 3,000 milligrams of sodium per day, sometimes closer to 4,000. The recommended limit for people over 50 is 1,500 milligrams per day. That means many older adults are eating 2 to 3 times more sodium than their kidneys can safely handle on a daily basis. And it is not just coming from what you add yourself. Canned soups, deli meats, frozen dinners, restaurant meals, breads, condiments, and even things that do not taste particularly salty, like cereals and cottage cheese, are loaded with sodium. So even if you are telling yourself you do not use that much salt, the packaged and processed foods in your kitchen may be delivering a sodium overload with every single meal. But here's the thing that really makes this habit so dangerous for people over 60 specifically, and it goes beyond the sodium itself. It comes down to how our kidneys handle sodium as we age. When you are younger, your kidneys are relatively efficient at flushing out excess sodium through urine. But as kidney function naturally decreases with age, this process slows down. Your kidneys become less efficient at excreting sodium, which means the excess sodium stays in your body longer, circulates in your bloodstream longer, and causes damage for a longer period of time with each salty meal you eat. Additionally, older adults are more likely to already have one or more conditions that interact with high sodium intake in dangerous ways. High blood pressure, type 2 diabetes, and heart disease are all extremely common in people over 60, and all three of these conditions dramatically amplify the kidney damage caused by excess sodium. If you are over 60 and you have even one of these conditions, your kidneys are fighting a battle on multiple fronts every time you sit down to a high sodium meal. Now let us talk about something that many people in this age group experience but rarely connect to kidney function. Have you noticed your ankles or feet swelling by the end of the day? Have you been waking up at night more often to use the bathroom? Are you finding it harder to control your blood pressure even when you are taking medication for it? These are not just random signs of getting older. These can be early indicators that the kidneys are struggling to manage fluid and sodium balance in the body. Most people dismiss these symptoms or chalk them up to aging. Their doctor might adjust a blood pressure medication without anyone discussing the underlying driver, which is the daily sodium load the kidneys are being asked to process. And so the habit continues, the damage continues, and the symptoms gradually get worse over the course of months and years until they can no longer be ignored. Here is another piece of this puzzle that rarely gets discussed. The kidneys and the heart are deeply connected. They constantly communicate with each other through hormonal signals, blood pressure regulation, and fluid balance. When the kidneys are being damaged by excess sodium, the heart feels that strain almost immediately. The heart has to pump harder against higher blood pressure. The walls of the heart thicken over time trying to manage that extra workload. And conversely, when the heart is under stress, it sends signals that cause the kidneys to retain even more sodium and water, creating a dangerous cycle. Cardiologists and nephrologists, meaning heart doctors and kidney doctors, actually refer to this connection as cardiorenal syndrome, and it is increasingly being recognized as one of the most important factors in why older adults develop both heart disease and kidney disease simultaneously. The kitchen salt habit sits right at the center of this cycle for millions of Americans. Now, you might be wondering whether simply switching to a low-sodium salt substitute is the answer. This is where things get a little more complicated, and it is important to know this before you make any changes. Most salt substitutes on the market replace sodium chloride with potassium chloride. For healthy individuals, this can be a good option. But for someone over 60 whose kidneys are already declining, high potassium intake can actually become dangerous. The kidneys are responsible for filtering excess potassium out of the blood, and when kidney function is reduced, potassium can build up in the bloodstream to levels that are harmful to the heart. This condition, called hyperkalemia, can cause irregular heartbeats and in severe cases can be life-threatening. So if you are over 60 and you are thinking about making changes to your salt intake, the most important step is to talk to your doctor and get a kidney function test, because the right approach for you depends entirely on where your kidney function stands right now. What does a kidney function test actually tell you? The most common test is called an eGFR, which stands for Estimated Glomerular Filtration Rate. This is a simple blood test that measures how well your kidneys are filtering waste products from your blood. A healthy eGFR is above 90. Between 60 and 90 means mildly reduced kidney function. Below 60 indicates moderate chronic kidney disease. Below 15 means kidney failure.